in North Carolina.
Thank you, Dr. Michaels, for the kind introduction. So the title of my talk is Minorities Do Not Have Worse Outcomes for Diffuse Large Cell Lymphoma, which I'll refer to as DLBCL if optimally managed. So DLBCL is the most common and potentially curable non-Hodgkin lymphoma. Previous studies have shown that minority populations have worse outcomes compared to Caucasians, and I think my previous speakers have alluded to that as well. And uninsured and Medicaid patients with DLBCL have inferior survival compared to those with private insurance, and minorities are often underrepresented in clinical trials. So I work at Levine Cancer Institute, where we have a significantly large, underserved population, and it's a safety net cancer center. We have a robust nurse navigation program, which allows for a lot of support in terms of, transportation benefits, lodging benefits, trying to coordinate care between, different providers, reminding patients for appointments. So a lot of support for patients, especially those who need. And, and one of our main goals is to try to overcome socioeconomic barriers and achieve equal outcomes irrespective of race or insurance status. So with that in mind, the purpose of this study was to compare the outcomes as measured by progression-free survival and overall survival in Caucasian versus non-Caucasian DLBCL patients treated at our center, and to compare the frequencies of clinical trial participation between minorities and Caucasians, as well as stem cell transplant between these two groups. So the population was de novo DLBCL, and we captured race, Caucasian versus non-Caucasian, and then we also collected the demographic information, prognostic information, as well as insurance data, and then the treatments offered, including participation in clinical trials and stem cell transplant, and then we looked at outcomes. So as you can see over here, sorry, the top of the slide is cut off a little bit. The Caucasians, non-Caucasians or minorities were 23%, and of which the largest proportion was African American. If you look, there were differences between the two groups in terms of median age. Median age was younger in non-Caucasians. There were no differences in gender. And then in terms of nurse navigation, as I spoke, a large proportion of patients, irrespective of race, got nurse navigation. The total percent was 85% of our patients. And there was no statistically differences between minorities versus Caucasians who got nurse navigation. And if you look at insurance types, there were more patients in the Caucasian group who had private insurance, and there were some uninsured and more government insurance in the non-Caucasian group, and that was also statistically significant. And now looking at our disease data, so there are some standard prognostic markers which help us to understand the biology and the prognosis in diffuse large cell lymphoma. So whenever you're comparing two groups, it's very important to understand that both groups have no significant biologic differences which would skew results one way or the other. And as you can see over here, that patients who had were Caucasian had similar prognostic markers, RIPI and double hit, compared to non-Caucasian patients. They also received similar frontline treatments, majority of which were anthracycline based, like R-CHOP. And then the number of patients who relapsed after the frontline therapy were also equal in both groups, and the median number of treatments were the same. So our next step was to look at clinical trial enrollment for patients with, who were Caucasian versus non-Caucasian, and we saw, as it has been previously discussed, that there are differences and minorities are underrepresented, but at our site we have had equal participation in clinical trials, and also no statistical differences in patients who got stem cell transplant. Numerically, it appears more in the non-Caucasian group actually, although there is no statistical difference. The progression-free survival for this group of patients is shown in this slide, and there is no significant difference. Again, the 2-year PFS was 60 versus 63% in these two groups, and then same with the overall survival, there is no significant difference. My conclusions are Caucasians and non-Caucasians had similar survival outcomes for diffuse large cell lymphoma, and high utilization of nurse navigation program, equal access to standard treatments and clinical trials, as well as stem cell transplant may abrogate inferior outcomes seen in minorities, which were previously reported in studies. So I think the key message is that if you are able to offer the same treatment and clinical trials to people irrespective of their race, socioeconomic status, and provide support, you can get equal outcomes as long as the biology is the same in both groups. Thank you.